All right. Hey, everyone. My name is Jenny Castle. I'm a dietetic master's student and intern here at Augusta University and the new public relations chair for the Augusta District Dietetic Association. As you may or may not know, November is National Diabetes Month. So it's only right that I'm here to introduce Kim Beavers, a registered dietitian and certified diabetes care and education specialist here in Augusta, as our guest this month. Hey, Kim, thanks for being with us today.
Hey, Jenny, thanks for having me.
Of course. Can you tell us a little bit about what it's like to be a registered dietitian who specializes in diabetes?
Sure. So, being a dietitian who specializes in diabetes is really kind of interesting because you really can impact people's lives and their health in a big way. And of course, nutrition does that in a lot of other diseases too. But diabetes is a chronic condition and it affects so many people in our country. And then 1 in 3 people, of course, have pre-diabetes. So there's a lot of room for work in this field. And as a dietitian, I can kind of impact people in a couple of different ways. One, I can do medical nutrition therapy, which really dials in and focuses on nutrition, but also as a diabetes educator, my scope of practice can be larger. So that's where you're really helping people with every aspect of diabetes. So while my specialty is nutrition, I've also had training in like blood sugar monitoring, disease prevention, or preventing complications from the disease of diabetes, and things like that. So really you kind of have a little bit more global impact on somebody who might have diabetes, or even helping somebody prevent the onset of diabetes who has pre-diabetes. So really there's, if you care about people and like helping people, it's a really big profession, and you can have a lot of impact.
Yeah, absolutely. Well, I was going to ask you how you've impacted your local community. You've touched on that a little bit with that first question. Can you tell me maybe one of the moments that stands out the most where you've been able to help somebody with their diabetes?
Sure. So, so moments that stick out are always going to be when you've helped a patient. So, I have a couple different roles in diabetes and a couple different jobs in that realm. So, some of the things that I really find impactful are when I have followed someone for, say, I've seen them once, twice, 3, maybe 4 times. So I've followed the course of their disease and been able to see the improvements that they've made. And really my role is just to encourage them, help them, point them in the right direction. The patient does all the work, really. But oftentimes in our healthcare system, it's hard to navigate. Sometimes there's negative things that happen in healthcare, and just helping that patient be a positive influence for them and support them is really powerful. And so I've had patients come in with an A1C, which is a measure of blood sugar, an A1C of say 9, which is way outside the target range. Somebody with diabetes, the target range for their A1C is below 7. And the reason for that target is that less complications happen at below 7. And so we're always trying to help our patients get to an A1C of less than 7. So let's say I recently have seen several people with A1C of 9 or so, and a couple of them I've been following for a while, and their A1Cs are down to 6. So that's huge impact. And really that is correlated with significant improvement and disease risk prevention. So like it could, an A1C drop of 1 point actually decreases somebody's risk of damage to their kidneys, their eyes, and their nerves by over 30%. So that's huge. So impacting the community is really by improving the health of the community, but also helping people obtain that, or patients obtain that. Because sometimes they feel like there's so much involved with diabetes and it can be somewhat complicated. Even though it's common, it's still kind of complicated, and they get overwhelmed. And so really being able to support somebody and see them achieve that goal, and then see them be happy and joyful over that, and have more of a positive light in their life is really awesome, and makes you feel good as a practitioner.
Yeah, absolutely. You touched on diabetes being such a complicated disease. Could you maybe explain briefly for those who don't know what it is to be diabetic and what diabetes means?
Yeah, sure. So diabetes is basically, bottom line, when your blood sugar stays too high for too long. And I mentioned also pre-diabetes, and that's of course when somebody has a blood sugar level that's not quite a diagnosis of diabetes, but does indicate that there's a problem with blood sugar management, that their body is struggling to manage that blood sugar. And so the extra blood sugar is what creates the damage. So we all need blood sugar, but when it's too high for too long, that's what creates the prediabetes and the diabetes, and also the potential damage from that blood sugar. And so what our goal is, of course, is to help people control that and get that back down.
Yeah, awesome. Thank you. And just a fun one, can you say one of your favorite experiences working as a dietitian?
So I think I mentioned like bringing someone's A1C down or helping them, right? Again, they do all the work. I just kind of point them in the right direction. But that's always fulfilling. But one of my patients actually like said I was a blessing. And, you know, like when anybody calls you a blessing, that's pretty special. But all I really did was help her get her meter and strips for like $12 less a month than she ordinarily would have gotten it for. Because again, the healthcare system is really kind of difficult to navigate. Insurance is crazy. And so when you work in a certain field, you start to understand like what insurance will cover which meter and that kind of thing. And so just helping people navigate that system and realize that I can help save someone money. That's impactful for them, and also makes me feel, again, fulfilled that I've helped them. And again, that's $12 a month she's going to save. So that's awesome. And so, yeah, it's just really nice to be able to be a champion for patients, and then have someone appreciate you like that is certainly very meaningful.
Absolutely. Do you think diabetes is reversible?
That's an excellent question. It's all over the media. So I usually kind of say we can put it in remission, but to say that it's reversible is a really, really strong statement, and it's not going to work for everyone. So this question probably comes up almost every class that I teach. I want to get off my medication, right? Who wants to take medicine? So it oftentimes depends on how early diabetes is caught, which is really a great lead in to why we talk about diabetes a whole month, National Diabetes Month, because we want to prevent diabetes. So I'm going to pop a link, or get you to pop a link into the Facebook group on a diabetes screening test that everybody should take. And if they answer the questions and are at risk of diabetes, they need to see their doctor so they can get a handle on it and prevent it fast. Because the earlier we address high blood sugar, the longer we can go without diabetes, and the longer we can go with less medicine. So can we prevent diabetes? Yes, if we catch it really early in the prediabetes stage. About 50% of people can prevent diabetes. 50% of people will go on to develop diabetes. But the more that we do to control it, the less medicine we will have to take and the less complications we will have. If somebody has come in for the very first time and they've had diabetes for a while, but it wasn't diagnosed and their A1C is really high, they probably can't get off their medication completely, but they can probably work on their diet and activity routine to where they can decrease their medication. What we do know is that once someone is diagnosed with diabetes, oftentimes 50% of their beta cell function, which are the cells that make insulin in your pancreas, about 50% of that beta cell function is not working, or that they don't have 50% of their beta cell function. So asking someone to reverse diabetes with 50% of their beta cell function is a big ask. But can we improve it? Can we make it better? Yes. Can we reverse it? Probably not. But we can maybe put it in remission if we catch it early enough.
Right. Great. Well, thank you for being with us today, and all the great insight and all the work you're doing to prevent and help people manage their diabetes. Anything else you want to add that you think people should know?
No, I'm just going to pop that risk test in the Facebook page, take that, address it head on. It's not fun to get a diagnosis of prediabetes or diabetes, but the sooner you do it, the better you're going to be.
Yes, and see a diabetes educator, registered dietitian to help you manage it.
Absolutely.
Well, I hope y'all enjoyed our video for this month for National Diabetes Month, and be sure to tune in next month to hear from another registered dietitian in your community.
Thanks, Jenny.
Thank you.